Hello from the Asian Development Bank in Manila. My name is Steve Godfinch. I'm with ADB's Sustainable Development and Climate Change Department. And it's my pleasure to welcome you to today's hotspot session on compound hazards at the Resilience for the Urban Poor Forum. Compound hazards, that's when multiple hazards occur simultaneously or one after the other, has come to prominence as many countries continue to manage climate and disaster risks while also responding to the COVID-19 crisis. The impacts of climate change, including climate variation and more frequent and intense natural hazards, is increasing the complexity of the disaster riskscape across Asia and the Pacific. And this is particularly prominent for the urban poor. Density, lack of services, limited infrastructure, the absence of social protection and ineffective environmental management, along with the built environment, can increase the vulnerability that the urban poor face to compound hazards. Today's session will explore the increasing complexity and uncertainty that compound hazards present in the region and discuss the impacts this has on the urban poor. So this is a large and complex area. For today's session, we're going to narrow the focus a little bit further and look at urban displacement and solutions to strengthen resilience. We have a great panel to bring in a wide range of expertise and perspectives. We'll start today's session with a presentation from Sanjay Shrivastava to set the scene. Sanjay is the Chief of Disaster Risk Reduction at the United Nations Economic and Social Commission for Asia and the Pacific. We'll then move to a panel discussion where we'll be joined by Vicente Anzolini, Manager of Global Monitoring and Reporting at the Internal Displacement Monitoring Center, and Maria Moita, a Senior Regional Emergency and Post-Crisis Specialist at the International Organization for Migration. And finally, Enamul Siddique, Interim Country Director at Oxfam Bangladesh. The links to their bios can be found in the speaker's profile page. To get things going, I thought we would have a poll question. So we'll launch the poll, and the question asks, where do you see the greatest opportunity to strengthen the resilience of urban poor to compound hazards? So we'll just give everyone a moment there to select an answer. Okay, and if we can see the results, let's have a look at those. Just waiting for those to come up. Here they come. Okay. Okay. I don't see those results. So why don't we just move on and we can come back to that. I think that's fine. So let's get underway then with our presentation. Before I hand over to Sanjay though, I would like to invite you all to ask your questions in the Q&A box, and let us know if any of the questions that other people have raised resonates with you by liking it. And that will help us identify the questions that you'd most like answered when we go to the Q&A session. So with that, it's my pleasure to pass over to Sanjay. Sanjay, the floor is yours.
Yeah. Thank you, Steve, and thank you, colleagues of ADB for giving this opportunity to UNESCAP and especially to me. This topic, as Steve said, is, I think, confronting all countries of the world. And the urban poor bears the hit hardest, really bears the brunt of the compounding effect. I will shed some light how urban poor is experiencing the compounding effect, how they are coping. So my next slide is on, if you convert all disaster risks of Asia Pacific region in terms of money, the monetary value of disaster risk, then how much it is per annum and which hazard contribute large. So in UNISCAP, we use the probabilistic risk assessment model and develop the multi-hazard risk map in terms of annualized average loss. And to surprise, the 60% of the region's risk escape, which comprises tsunami, floods, tropical cyclone, earthquake, and drought, extreme climate event, plus geophysical hazards. The 85% of the region's risk escape occupies by the climate-related hazards, and to a very large extent, 60% of which is drought. It is slow onset disaster. The impacts are unlike earthquake, not as structural, but those are visible in terms of the multiple sector, the productivity losses, the livelihood losses, and many part of it. So we have used the direct and indirect losses, the losses across the multiple sectors, and then quantified what could be the annualized average loss due to multiple hazards in Asia Pacific region. And this is 675 billion, is around 2.4% of region's GDP. So it's the fastest growing region of the world. 2.4% losses, annualized losses, are certainly not a challenge for achieving sustainable development goals by 2030. So my next slide will show you where these impacts are felt the most: the economic impact, the impact on livelihood, and all kinds. So if you look at where our cities are located in Asia and the Pacific, what we have done is we have mapped out cities on the background of multi-hazard risk map. And you notice very clearly that the cities, including Manila, Dhaka, Delhi, Beijing, they are all Jakarta. They are located in multi-hazard disaster risk hotspots. It's not one disaster, it's a disaster of multiple kinds, which are floods, tropical cyclone, cities located in typhoon tracks, city located in seismic high-risk areas, cities located in floodplains. So, the cities by their location in risk hotspots are bound to lose large. But what is important that I would like to bring to your attention is 70 cities fall in the extreme risk category, 314 in a high risk category, and 155 in a medium risk category. They are the growth engines of the regions. And if they are located in multiple risk hotspot where the disaster losses are bound to be very high, it has its own implication on sustainable goals. My next slide is going to show the impact of disasters over the year. I don't want just to show a snapshot of the numbers, but let us see the aggregated impact of disaster on cities and the citizens of the cities. It is interesting to see because we use a parameters that is inequality, the Gini coefficient. It's an aggregate of the impact over the large years of disaster and many others, but which finally led to the inequality among the people. But when you look at inequality from the disaster lens, from the disaster-related risk lens, what is interesting to see that 56% of the population live with medium and high level of inequality. And that shows that there are many drivers of inequality: economic growth, education, health. Disaster is also a driver of inequality in the region, and we contribute substantially to the inequality. My next slide shows that inequality is not only in the mega city. Inequality caused by disaster is not only in the mega city. The cities with 10 million or more population, you see it is the same trend. Cities with 1 to 5 million showing the same trend. And you see from a medium to mega cities to the small cities, the inequality and disaster are showing almost same trend. So disaster risk contributes to the inequality, and particularly in the cities, and which are inequality, the biggest phase of inequality in the cities are poor and the vulnerable population. So my next slide is going to show you one example how this inequality and how the disaster risk accumulates over the year. This is an example of Ho Chi Minh City, Vietnam. And you see in 1989, the settlements of Vietnam were primarily, means relatively at a safer location. So the flood, when you see the regular flooding area in Vietnam in 1989, were quite, means average was less than 1,000 hectares. But when you came to 1999, you see how it grows. But in 2015, you see the exponential rise in not only in inundation, but inundation death of Ho Chi Minh City. And we have located on the satellite images, those are all the new settlements which are in low-lying areas and in the peripherals, in the semi-urban areas. So you are growing on the risk hotspots. And that's the reason the urbanization, the inequality, what we have seen is clearly evident when you zoom in this scenario in one particular city, that is Ho Chi Minh. It comes out very clearly, and this is more or less the trend in most part of Asia and Pacific regions. So my next slide is going to tell you that if you take the future scenarios, what is going to happen to mega cities, especially cities with high population density who are poor, city with bigger slums. We have taken the examples of Mumbai, India. Asia's largest slum is here in Mumbai. And you see in a two climate scenarios, 4.5 and 8.5, the slums, the cities, their risk level, particularly the urban poor in Greater Mumbai, are getting larger and larger. And so my next slide is going to show what is the scenario exactly on ground. This is what Steve told in the beginning of this program. What he said, I presented this in form of a graph. You see a scenario that exists today is a scenario of the risk driver where you have poverty, inequality, rapid urbanization, and so on. So it's already on the ground with high population. Then scenario B is intersects over scenario 1, which is natural hazards, extreme climate events, floods, drought, and cyclones. So these two collide. Then you have another scenario, which is recurrent biological hazards, waterborne, vector-borne diseases, which are due to the flood, tropical cyclone, and so on. So you have scenario 3. And now you have a scenario 4, which is COVID-19 pandemic on ground. So you see the cities are in the cross-section of 4 different scenarios. It's risk drivers, scenario B, which is a climate extreme, scenario C, those health-related hazards, vector and waterborne diseases, which are associated with natural hazard. And then you have additional biological hazards like pandemic 2. Now the countries, we have analyzed this. The capacity of country to manage compounding risk of this kind is very limited. There is so much uncertainty to where this risk will move if you bring lockdown in one part of the city, where there will be a transmission in another part of the city. You know, there are multiple uncertainties, all of you are aware of it. So most of the countries find very difficult to manage compounding risk at a time on ground. So my next slide will show you exactly a very interesting example of what we call compounding risk, systemic risk. This is the cyclone Amphan, which is one of the worst cyclone in 2 decades in Bay of Bengal. and that happened in May last. And that was the time the COVID was spreading in Bangladesh and in India, eastern belt of India. So you had the migrant laborers coming from the city to those cyclone-prone area, and then at the same time, cyclone hit. There was a very large number of evacuation thanks to cyclone early warning system. Despite such a massive cyclone, the casualty level was bare minimum in both in India as well as in Bangladesh. They evacuated 3 million in Bangladesh, 2 million in India. As a result, they could able to protect life. But what could not happen was there were many response agencies, many people who were in the cyclone shelters, which were basically, this is where the people are evacuated and kept to protect themselves from the cyclone, particularly from the wind and storm surges. Those response agencies, they called National Disaster Response Force, there were a large number of infections, the COVID infection, because they came in contact of the people who came from the cities. Some may have were infected by COVID, and there was a large number of COVID infection, and this caused this triggered like a real event which spread the COVID. So when you see the collision of two events, a biological hazard with natural extreme tropical cyclone, with collision of two events, biological and tropical cyclone, the risk gets multiplied and multiplied. My next slide is going to show you yet another scenario, but in a very interesting way, particularly in context of urban poor. This is this year and last year scenario. Cyclone Nisarga in June 2020. This cyclone Nisarga hit western part of India and hit Mumbai, the urban city with the largest Asia's slum located over there. And when in 2020, when cyclone Nisarga hit, it was another deadliest cyclone in Arabian Sea. That time, the COVID cases, you see the number of COVID cases in my left-hand side. The COVID cases were growing, and then cyclone hit. So this cyclone and COVID together, it put a lot of pressure on health and response agencies. As a result, Mumbai became like a super spreader in the countries. To some extent, it was contributed by such kind of a collision of disasters together. Just 1 year later, there was another cyclone, Taukate, hit Mumbai. And this was the second wave of the COVID. It was very, very devastating in India, in Mumbai, urban cities. So here you see the collision of two, what is called what we call is the perfect storm. A storm of the COVID transmission, a storm of the cyclone Taukate, again one of the deadliest in 2 decades in Arabian Sea together. But then what made the urban poor to survive? I'm coming to my next slide. Despite the compounding disasters on ground, you have seen in last 1.5 years, particularly in case of Mumbai, you saw 2 cyclones, many cyclone-related floods. This is a story of Asia's largest slum called Dharavi, area of 2.1 square kilometer, and population you see 1 million. So population density is 277 more than per kilometer. And this is where the COVID, this kind of slums where COVID hit, it becomes like a super spreader. But it did not happen. It was not a super spreader. It started in the beginning, but slowly came down. At some point of time, the COVID cases in this slum was much lesser than the COVID cases in the other part of the Mumbai, which are affluent part of the Mumbai. But then what made poor to survive the COVID? What made the poor, thanks to the municipal government, the but more importantly, they could able to do a donation of the risk, narrow down the area where it spread, there could be a super spreading potential. Then they train and develop the community because they realize that they have to live with the COVID, so they have to protect themselves and use the 4T strategy, tracing, tracking, testing, and so on. And what is more important, which I would like to highlight, is the investment in trust building. Community knew that we have to live with it, and then we have to live with the local officials. So they started cooperating with each other. Any instruction on safety was followed almost 100%. So this cohesion among the community were very effective in this context. So my next slide is going to show what is became like a real success story worldwide. This is highlighted as a success story of urban poor in midst of the compounding risk. Chase the virus model. Chase the virus model is you communicate the risk very clearly, what to do, what not to do, participate community, public-private partnership, quarantine, isolation, treatment. So all put together work very well to protect people. My next slide shows that I think these are the two concluding slides, which I would like to conclude with important message. What to do? We have a Sendai framework in 2015. All of you are aware of it. It was a major paradigm shift in overall world strategy to manage disaster, from managing disaster to manage disaster risk. Manage disaster risk means what is most important is scale and system. You have seen today COVID, the scale, and also the system from one system to other system. In Sendai framework, health was referred 67 times, means health was at the core of the Sendai framework. But then health has to have a systemic approach to manage it. So this is the managing risk, preventing risk, and from risk management, and that Sendai framework from global, national, local, and system. My next slide, if you have to operationalize Sendai framework for managing systemic risk, means the compounding risk, what needs to be done? Transforming governance of systemic risk. This is what is the way forward, which many countries in COVID time or post-COVID time will be talking about and taking action. It's very well known in Sendai, it was very clear that it's a risk of climate, associated health hazard, biological, natural, and geophysical hazards. So these are the cluster of hazards, cascade of hazards, compounding hazards, which community will be experiencing at a time. Then you have what is really important is interdependent of infrastructure. That's where the transmission of risk happens, and global supply chain. The existential risk, particularly in case of the sea level rise, many cities located on the coast, and then cascading risk and compounding risk you have to manage from the perspective. So what is way forward? My last word is the risk is always global, but resilience is local. You have seen Dharavi Mumbai example. The focus on community and territorial government holds the key. Risk-informed financial mechanism, incentive and innovative technologies, integrated policy strategies planned at national, sub-regional, regional and global level, all need to be aligned. And that's the way forward. So I would like to conclude my discussion on this transforming governance of the risk holds the key. Sendai provides the framework, but operationalizing the framework at country level, at city level, is the challenge. Many countries are making efforts, and this is where we need to work in this. Thank you, Steve. Thank you, colleagues, once again for this opportunity.
Thank you, Sanjay. I think those four messages you presented really highlighted the immense challenges faced for communities and government. And as we look out to 2030 and beyond, and really some clear messages there for those communities and governments. You know, the 170 cities in extreme risk and the 314 at high risk. And equally, I think that message around, you know, disaster risk widening inequalities really underscores the need for action. And then I enjoyed hearing about the work done in Dharavi slum. I think, you know, some solutions there, but really highlighting the importance of community action and supporting solutions from within. So thank you for that. Let's move to our panel discussion now. And a reminder though, please do type in your questions into the Q&A box and we'll get to those shortly. But I'd like to start with Vicente Anzolini from IDMC. So Vicente, reflecting on Sanjay's presentation, what are some of the trends, what are some of the numbers we're seeing in terms of urban displacement, and what can you share around that from a regional perspective?
Thank you very much, Stephen, and thanks for having me. Good morning from Geneva, everyone. So regarding urban displacement, so the close relationship between rapid and badly managed urbanization and heightened disaster risk is well recognized, and I think that Sanjay's presentation really showed the relevance of this issue for the region. And although there has been important progress in addressing this challenge across the Asia-Pacific region, there is one factor that still needs, on my view, unpacking in this riskscape in Asia-Pacific, but also globally, is disaster displacement, and especially how urban the phenomenon is, because of course, Asia and Pacific is the most urbanized region in the world, and to really have a regional perspective and to be able to compare it against the global picture, it remains challenging. So we know that to measure, to understand how urban the phenomenon is, we know that it's happening, we know that it's even increasing, but how urban it is remains a major blind spot. So last year, there were a total of 30.7 million disaster displacements globally, and 21.4 million, or 70% of the total, took place in the Asia-Pacific region. So this is really showing that the region remains a hotspot in itself. I will break down a bit what are the hotspots within the region. But then I also wanted to share with you a couple of gaps, basically, that need urgent filling on our view. Why is this so difficult? Why it is so difficult to understand urban displacement? Well, the first challenge is to define really what an urban area is. This may seem like an easy question to answer, but actually, when it comes to collecting and aggregating the data on disaster displacement and mapping out to see how urban or rural it is, we are actually confronted to a major challenge that is not, because especially there's not an agreed upon definition of what an urban area is. For example, in India, there are different definitions than in China and than in the Pacific, and then therefore thresholds also vary from country to country, making it extremely difficult to actually compare. But second, I think that this is the major challenge, is that urban displacement encompasses forced movements from rural areas to urban areas, between urban areas, and within urban areas. So talking about the urban displacement actually needs to be broken down really by these different patterns of displacement, and obtaining information on these dynamics is extremely difficult. And most data collection actually gives an idea of where displacement flows originated, but not necessarily to where. And in some cases, we do have information that of people that move to cities, but even then, this may be even the tip of the iceberg, because many go to host families and relatives and basically go off the radar of first responders and the data collectors. So, but that said, since 2017 in particularly, in IDMC, we started to geolocate displacement information. So at least we said, let's at least unpack where this displacement originates, no? And we are starting to build a more solid evidence base on how this displacement is at least originating in cities. And the preliminary results of this work show that, unsurprisingly, there is an extremely high correlation between urban exposure and disaster displacement. And this underscores once again that one of the compounding impacts of disasters in Asia Pacific is indeed urban displacement, because of course sometimes these movements put a strain on local and host communities, local authorities. Therefore, it's really needed that we fill in these gaps. And actually, there are examples in the region where efforts have been made at the national level to really obtain a better picture. For example, I just wanted to give one example in Papua New Guinea, where the UN collaborated with private phone companies to use the anonymized mobile phone data to measure these patterns and the duration of displacement following the February 2018 earthquake. So this enabled them to obtain detailed information about when people moved, from where and to where, and for how long they remain displaced. So this is also to show that data can be obtained from many different sources, and this allows to really understand at least these flows. But what about the urban poor? Well, that is much more difficult to measure, no? And as Sanjay showed, the vulnerability layer is extremely important. So it is no mystery that in cities such as Mumbai or Kolkata in India, high levels of exposure to hazards such as floods, combined also with high levels of vulnerability, poor education, and limited access to critical infrastructure and livelihood opportunities. And this, of course, increases displacement risk and impacts, but also makes recovery longer. Now, also something I wanted to share is like a bit of hotspot analysis and displacement risk, because of course, I mean, we're starting to scratch the surface really on what are the impacts as they occur and what's the, let's say, historical perspective, but what about what comes next? No, we really need to understand risk in order to reduce it. And so, as I said, urban poverty and inequality play a significant role in the dynamics of urban disasters and the distribution of this risk. And in this sense, large cities that are home to millions of urban poor tend to be these hotspots. So I'm not going to enter into the details because I think that Sanjay's presentations really showed what are these hotspots. It is not surprising that many cities in India, Bangladesh, but also, for example, Jakarta, contribute substantially to the overall displacement figures. But I also wanted to highlight something is that also urban displacement and risk in general needs to be looked at proportional to countries' population. So although it may not seem the case, small island states like Vanuatu, Fiji, or the Solomon Islands may have also high levels of urbanization and therefore urban displacement. One example is that in Fiji, for example, approximately 90% of the population lives in coastal areas and more than half are in urban areas, with the urban population still steadily increasing. So urban centers are at risk from seaborne and river and natural hazards, cyclones, storm surges, coastal and river erosion. So again, the issue of compounding hazards here, no, that then are being accelerated and aggravated by climate change. So the climate change is expected to affect the country's coastal resources through higher marine temperatures and sea level rise, having profound consequences on some urban centers, agriculture and coastal development, and potentially leading to future displacement. So assessing this future displacement risk remains challenging because of the first challenge I highlighted is the lack of an agreed upon definition. But we took a step forward in this work and used the European Union's global human settlements layer. This is a layer that is produced globally for globally comparative purposes. And we actually tried to unpack urban, peri-urban, and rural, and results show that on average, 17.8 million people are at risk of being displaced by floods globally, of which 11.5 are in Asia and Pacific. So again, really the region being a hotspot. And if we really zoom in this model, I have a very interesting graph to show you, but unfortunately, due to time constraints, I'm not entering into details, but I invite you to check our material. I'll share links later on. It's really that we can, as we zoom in, we can really understand how within urban areas, where flood displacement risk is concentrated. So there are promising approaches, but for these we need better data. So I really wanted to underscore once again that be it to measure the current and historical perspective, but also the future risk, we need better data and we need, of course, definitions to be able to measure displacement risk. So I will leave it there, and in case there are further questions or comments, happy to respond. Thank you.
No, thanks, Vicente. I think that was really helpful, and IDMC does some really great work in helping governments and communities understand what we're seeing in terms of displacement and urban displacement. But let me bring in Maria Moita from IOM now. So Maria, I guess from a public policy perspective, what are we seeing? Where are some of the gaps in terms of dealing with urban displacement, and what can we learn from the region, perhaps in terms of solutions?
Oh, is that a mistake? Thank you, Steve. It's a pleasure to participate in this discussion, which is so important to the work of IOM. As you mentioned, I work with IOM in the regional office, which covers the countries from Iran to the Pacific. And today I'll be talking about first Vanuatu, then Philippines. But so for your first question, we know that Vanuatu is consistently ranked amongst the most risk-prone countries in the world due to limited resilience to frequent occurrence of natural hazards such as tropical cyclones, floods, droughts, earthquakes, tsunamis, and volcanic eruptions. The country also faces other significant climate change and development-related challenges that contribute to disaster displacement risk. Based on recommendations from lessons learned exercises conducted after the tropical cyclone Pam in 2015, the government of Vanuatu finalized the National Climate Change and Disaster-Induced Displacement Policy, which is also known as just a displacement policy, throughout a broad consultative process that included contributions from displacement-affected communities with the support of IOM. This process made Vanuatu one of the most advanced countries in the region in terms of displacement-related policies, and that's why I'm bringing this example to this discussion. The policy sets out 12 strategic areas of intervention in relation to disaster displacement. The system-level interventions include issues such as institutions and governance, evidence, information, and monitoring. It also delineates a broad set of sector-specific interventions, including land, housing, planning and environment, agriculture, food security and livelihoods, and traditional knowledge, culture, and documentation. Cross-country issues underpin this intervention, including partnerships, gender responsiveness, social inclusion, community participation, as well as disaster risk reduction, climate change adaptation, safe and well-managed migration. The policy has raised the profile of displacement in Vanuatu by establishing a framework for national plan of action on displacement that articulates the importance of coordinated operational and policy action on the internal displacement and identifies the potential contributions from different stakeholders. And it makes some recommendations, some of which have been implemented or partially implemented, which include establishing a lead ministry. And while that didn't exactly happen like this, but there is no single point of contact for displacement issues, there is now greater clarity on the roles of the NDMO and the Prime Minister's office in terms of transitioning from emergency response to recovery and durable solutions for displaced people. Through the establishment of the National Recovery Committee, for instance, the Prime Minister's office has assumed a stronger role in the recovery planning and finding durable solutions during the Ambai volcano eruption in 2018 that led to the mandatory evacuation of 11,000 residents. Again, this goes back to the point from Vicente. It was not, in terms of numbers, it's not huge, but it's the entire population of that island. There's also a point on strengthening professional and area level coordination. One of the actions that have been taken is the activation of the Displacement and Evacuation Center Management Cluster, which was activated and is led by the NDMO and IOM, and aims to improve coordination amongst the agencies and the organizations that work to assist displaced people. In addition, partners such as CARE and Vanuatu are working to strengthen community disaster and climate change communities. And finally, there's a point on data that Vicente talked so much, and one of the things that has been ongoing is the work of NDMO, also supported by IOM, to conduct regular assessments on demographics and the needs of the displaced population, which have been critical to support evidence-based planning and displaced communities. So two key challenges noted. One is that the multiple houses, and again, the compound houses that have been mentioned here, challenge the implementation, the successful implementation of the policy, because every time something happens, it disrupts the process. And also the lack of consistent funding to the policy being a problem to go throughout all the recommendations. And finally, one interesting gap identified was in relation to the increasing need to evacuate people facing floods, cyclones, and other hazards, as well as requests for assistance from communities facing eviction, land conflicts, or impacts of poor urban planning, which ultimately leads to displacement or relocation. So although there is a lack of clarity on which government department has the mandate to respond in these circumstances, the displacement policy offers a framework to protect and assist displaced people due to different factors, and with a common set of standards and principles to establish the durable solution. So I would
Thanks,
start.
Yeah, no, thank you for that. And I think, you know, while not perfect, you know, policies are important, right, to set that framework. And I mean, obviously, challenges in the implementation. So let's maybe move, shift the focus a little bit and move from that policy to practice. And I'll invite Enamel Sadiq from Oxfam, Bangladesh, to come in. Enamel, you know, Vicente was talking about that kind of relative invisibility around the displaced. And I wondered if you could share some reflections from the challenges that you see in Bangladesh and what some of the kind of opportunities are and where those opportunities lie to address some of those vulnerabilities. You know, what is some of the good practice that we can scale up, you know, that we know works and really needs to now, you know, be mainstreamed, for lack of a better word. So over to you.
Thank you, Steve. I think I will start from by linking what Sanjay was presenting and what Vincent was talking about. It's about unpacking the urban and rural space and also linking the inequality dimension with the multi-hazard risks that we have. The question that we are facing now, it is about invisibility of the people who are living in an urban space. And if we look at the root causes of that invisibility, it is because of the identity. In urban spaces, especially in areas like Bangladesh, a citizen is somehow, that identity is linked with the land ownership. And people who are displaced, who are temporarily migrating to a space or actually seeking refuge in some sense in that urban space, they don't have that ownership. And that's linked with their invisibility. And when they are invisible in the eyes of law, in the eyes of governance process, that means they are delinked from the planning process. They are delinked from any decision that is taking around that urban space. And it is linked with resilience. If you are not part of the decisions that is going to impact you, that is going to impact the kind of services that you can expect, or the kind of, I think, security that comes with it, like being part of an urban space, expecting the services from the urban governance process. That is all linked with this identity and land ownership and displacement. So that's concerning. So it's really difficult to find a good practice already that can be scaled up, because you have already seen in the map that Sanjay was sharing, Bangladesh is one of the darkest zones in that analysis. We have the highest of populations, multi-hazard risks, displacement and uncertainty. So good practices I might not be able to share with you a lot, but some things we have been trying from the civil society to push forward, which might be looked at at a systematic scale. One is engaging the citizens in the planning process through the disaster management committees and other citizen engagement processes, and including people who live in that city or expect a service from that city in those committees rather than only the landowners. So this disaster management system that has been created in South Asia, I think that's something that can be a good practice that can look, if it is linked with real resources for transforming the cityscapes, it can be a good way. The second thing that we have done, and we hope it will create a change, is the community-led processes in planning and projects. So community-led projects in smaller areas, especially where urban poor are living, and really giving them a scope to have efforts to transform the place where they are living in. So that's something that can be an opportunity. These are small initiatives, but this gives you hope that transformation is possible. And on the, I think, governance side of things, we have to start seeing these urban spaces at higher risk as service providing spaces, as hosting spaces for people, because there is a high uncertainty. People do not permanently move to a city. They come and they come back from the villages, they go back to the villages, and they really look for economic opportunities and security in these city spaces. And whether we are creating those in our planning process will be important to look at. I hope that answers some of the things that you were looking for. But it's a complex thing, and there is no clear answer to that unless we are really looking at a system scale.
Yeah, no, I think that's right, Anil. And as you said, it's an incremental, I think incremental learning and incremental policy change that's required. There's no kind of panacea here. I think your points around linking identity to resilience is really important, and that community-led processes, which actually goes back to what Sanjay presented, right, with the work in the Mumbai slum there. So I'm conscious of time, and I don't know where the hour went, but it has now. It is rapidly passing us by. Maybe we still have some time left, so please do submit your questions into the Q&A box, and we'll get to those. Maybe we can go back a little bit. I wanted to pick up on what Maria said, and I don't think we can get out of talking about COVID and COVID-19. So I wondered if you had any lessons that we've learned in terms of urban displacement in the context of the COVID crisis and what we saw and what positive aspects we can take and we can learn, because it's inevitable that we will face another pandemic or another kind of crisis on that scale. So what did you see?
Thank you, Steve. I'm going to speak a little bit about the experience in the Philippines, because if we talk about compound hazards, I think it's a great example. And if you look at what happened in 2020, when the country dealt with a volcano eruption, 3 typhoons, 1 super typhoon, 1 earthquake, and in total displacing 4.4 million people. And during this period, this is when the pandemic started, so 2020. And by the end of the year, we had over almost 500,000 people infected or cases of COVID and almost 10,000 deaths. So one of the things that we saw in the Philippines is that what are the impacts when the governments rush to, of course, deal with the impacts of the pandemic and focus on sustaining economies and address public health crises. Often the resources that are usually allocated to support displaced populations were even reduced. And also the other point that we saw is that some of the measures to, of course, mitigate the impact of the pandemic had a severe impact on displacement, such as mobility restrictions. For one hand, you couldn't have the displaced people couldn't access their livelihoods or education or health services for that matter, even for the fear of contracting COVID on their trip to the health clinics. Really hampered the access to them to provide assistance, also by the humanitarian providers. And so we were facing with multiple levels of challenges where we need to protect, but at the same time you can't access. One of the things that was in the government of the Philippines, which is really active in trying to set up an interagency task force for the management of emerging infectious diseases resolution, and the National Task Force, they looked at ways to address this situation. And for instance, as one example, the SWB worked with the CCCM and protection clusters to adapt and contextualize some of the CCCM usual operational guidance to incorporate COVID measures. So as an example, they revised and worked with the local government units to try to decongest sites. As we know, the conditions in which IDP usually lives are congested. Don't have health or water and sanitation facilities. So one of the key principles or actions was to ensure that those were provided, ensure that there were healthcare and protective gear, the protective personal items to protect IDPs from the disease as well. And as looking at the broader impacts in terms of socio-economic as well. One of the interesting examples from there as well is that the Department of Labor and Employment implemented an emergency subsidy targeting over 300,000 displaced worker beneficiaries from the informal sector. And one last thing, just also, I think it was really interesting, and we saw that across the globe where we all resorted to innovative approaches and a lot of the virtual and telecommunications support. And so that was also the case in the Philippines for assisting displaced community with setting up the two-way communications to obtain information using technology and see what guidance could be provided to them for their situation. One of the things that was a critical gap, for instance, was access to information on quarantine protocols, and that was done remote technology as well. If I may, I'd just like to make one final point, because I think it's important, and which is how these experiences, a lot of what we mentioned during this discussion, reflects or speaks to the recommendations from the high-level panel on IDPs, the report shining a light on internal displacement, a vision for the future. And just a few points that I'd like to highlight: make solutions a nationally owned and whole of government priority. Political will is key and should be catalyzed. Ensure the whole of society is invested. Strengthen the effective use of internal displacement data. Address the drivers of displacement and reduce displacement risks. Strengthen the quality of protection assistance to IDPs and host communities. And finally, sustain momentum and ensure robust follow-up. Thank you.
Thanks, Maria. I want to pick up on that point around subsidies and so I guess social protection more broadly. And maybe I can bring in Vicente here, because I wonder what work IDMC has done on kind of quantifying the economic impacts of displacement or displacement risk. Because I think, understanding the cost can support action and budget allocation, right? And investments in social protection. So are you able to share any thoughts on that?
Yes, sure. So back to the issue of ourselves confronting us to a series of data gaps. A major one is really to understand how many people remain displaced as a result of a disaster at a certain point in time. Especially our cutoff date is end of year. But we're starting to get this data for disasters globally. It was around 7 million people that remained displaced, and we try to cost that out to understand. How much does it cost to really respond to the immediate needs of an IDP? And the figures, I don't have them right now on top of my head, but they are on our global report. But we do have some figures. And basically, but again, they are limited in the sense that it's only on the immediate, right? And as time passes, we really lose track of these people who remained in displacement. We know that there is people that remain displaced because of the Fukushima disaster. We know that we have some information about people who remain displaced due to cyclone Amphan. How these vulnerabilities have evolved over time, how a humanitarian response and development assistance has helped them to improve or recover. This remains very difficult, but at least we're starting really to unpack those economic costs. We are currently engaging actually with ADB on a project on to really dig in at the more national level in certain countries, including Nepal, Papua New Guinea, to really understand what are those costs. Beyond the immediate phase, an immediate impact of a disaster, but doing these assessments is much needed, no? And I think that for any damage and loss assessment due to disasters, really should try to really have longitudinal data, time series data, to allow us to understand how this evolves, no? And once again, also when it comes to the urban poor and more assessing risk, and because of course risk assessments are very much focused on economic loss, right? But we have not been able to really tailor in the issue of displacement as part of this economic loss, right? So we're trying to, because so far what we do to assess displacement risk is to use the likelihood of housing destruction. But we know that displacement is much more than just losing our one's house. It's really about losing your livelihood, social safety nets, networks. So we are also embarking in trying to unpack the vulnerability layer beyond just structural vulnerability of housing, but to really understand what does it mean to be displaced, how much would that cost, and then if we really have that layer, then we'll be able to put together a risk model that will be much more accurate and that could inform a much more tailored policy and action for those most vulnerable. So I can share with everyone some of the links to our economic costs and economic estimates assessments. And this is a work that we will continue embarking on and supporting in the years to come.
Thanks, Vicente. I think, again, comes back to that question of visibility, right? And that identity that Enamel was talking about. We have a question that's come up on the Q&A. So I'm going to ask, I'll ask Enamel first for his response to this one. So how do we mobilize pro-poor investments for resilience in post-COVID recovery? So what are your thoughts?
It's a big question. There are many.
You can take it from any perspective.
I'll just give a small example, a very micro level example. It's from Jodhpur city in Bangladesh. It's facing many hazards, including cyclones, erosion, floods, many things. But Jodhpur is a destination for a community known as Bede, or they have other identities, but they live in boats. So fisher folk who live in boats, who took refuge in this city more than 50 years back, but they're still living in boats. And what happened is, because they are invisible, the entire city's development did not include them. And in fact, all that development produced pollutions, which was diverted toward the space, the riverbank, where this community lives. So they were excluded. What we did, we started engaging with this community, and we brought us very small resource for them to plan for their own services that they need. And one of the key services that they needed was water, sanitation, and health. Now, this community does not own land. They live in the river. What they did, they came up with a solution for themselves for floating wash centers, which will, like, they live in both, and their wash centers also are floating. They are co-designing it with us now, and we are going to implement it. But they found a solution for them. If we had included them in the city's resource planning process and investment planning process, they could have come up with this idea, and this could have been part of the mainstream investment for that city's development. This is just an example. So the key is to really reach out to the people, not keep them invisible, and give them a say in the planning process. And they can come up with the solutions themselves if we can really be a supporter and service provider, rather than someone who's controlling the resources. I hope that answers partly your question.
No, I think that's a really good contribution, and recognizing that, you know, the structures that are there may not be that accessible for some people because they've been excluded, as you said, right? In your example, they weren't included in the cities, in the areas planning. However, they did have solutions. So it was really about making sure they had that entry point to be able to engage and provide solutions for themselves. Maria, we've had a question now come in about scaling up disaster resilience financing to help poor and vulnerable populations, or I guess displaced, you know, that includes under that umbrella. So do you have any thoughts on how we can best scale up finance in that respect?
Well, I think some of, again, going back to the high-level panel report, I think has really interesting recommendations. Also, I didn't mention that one, but there's also on the financing as well. I think it's really interesting, and I think it starts with thinking that it's a whole of government priority. And if we think, and some of the aspects that both Vicente and I were saying is, what are the costs and what are the implications of displacement at the financial level? If it's really understood, if it's measured, and if it's prioritized as something that we need to address, that will certainly be a key entry point. Include that in the discussions when we plan humanitarian assistance as well as recovery. It should be from the onset that we start looking at the social economic impact and how do we try to scale up those financing of the research.
Okay, thanks for that. Okay, unfortunately, that's all the time we have for this session, and I hope everyone found it useful. I think for me, one of the key takeaways was really that imperative to understand risk, which goes back to the Sendai framework, which we talk about a lot, but it's really important because then it links into what our panelists were discussing around the issue of invisibility and linking identity to resilience. And then being able to leverage some of those solutions once you do that. So I think they're really helpful and important contributions. So let me thank Sanjay for his presentation earlier again, and to our panelists, Vicente, Maria, and Enamel. And thank you everyone for joining today's session. I hope you enjoyed it. Thank you.